Hi, my name is Taylor Yundick, and I am a student nurse at the University of Michigan School of Nursing. I'm going to be presenting a patient to you today. Patient is a 57-year-old Caucasian married male. Current job is a mortgage banker. Patient was admitted to Beaumont Hospital in Royal Oak, Michigan in June of 2015 with a chief complaint of tenderness as well as a notably enlarged lymph node on his neck, which patient explains to have been the size of a golf ball. Patient was eventually diagnosed with a late stage 3 squamous cell carcinoma of the tonsils, caused by the HPV virus or human papilloma virus. After months of treatment, patient was diagnosed as cancer-free in February of 2016, but still continues to attend his follow-up appointments. Patient's current vital signs are all within the normal range. Blood pressure 128/84, temperature 98.2 degrees Fahrenheit, pulse rate 62 beats per minute, and a respiration rate of 20 breaths per minute. Patient's cancer interfered with his daily activities as he could no longer talk or eat. Patient felt fatigued by the chemotherapy and radiation treatment and could not carry out his usual daily activities, such as exercise or going to work. However, patient continued to work from home for a few hours compared to his regular 8-hour workday. Patient reports no history of chronic or serious illness. Patient's immunizations are all up to date. Patient reports no allergies or drug reactions. Patient reports no previous surgeries or hospitalizations prior to the cancer. During patient's most recent hospitalization, chemotherapy and radiation were used to treat the cancer. Patient received radiation to the throat 5 days a week for a continuous 7 weeks. Patient explains that he is not on any current medications and does not drink alcohol or use drugs. Patient describes having good health habits as he exercises every day, which consists of 30-minute runs followed by weightlifting. Patient reports that he never was a frequent drinker, and his diet is typically healthy, and he explains that he tries to incorporate protein, fruits, and vegetables into all of his meals in order to maximize the nutrition. Patient explains that he no longer drinks coffee after trying to cut down on his regular daily intake. Typically, patient explains getting 5 to 6 hours of sleep a night. However, he explains that he feels rested each morning. Psychosocial. Patient currently lives with his wife in a suburban home, and his 2 children often come home from college on the weekends. Patient feels that he has tremendous family support from his wife, children, and extended family. In order to cope with his cancer, patient said he turned to spending time with his family and watching his favorite sports. Since being cancer-free, patient explains that he no longer feels stressors in his daily life. Patient is of the Reformed Jewish faith and attends synagogue with his family during the religious holidays. Patient got a high school degree and attended college for 2 years. Patient attends his routine checkup visits and now continues to see his oncologist for routine appointments every 3 months. Patient explains having no family history of disease. Patient described his overall health as being very good and his lifestyle is healthy and active. At the time of his cancer, patient experienced altered nutrition related to decreased oral intake of food due to his diagnosis. Patient received his nutrients from a feeding tube and lost a total of 38 pounds over the course of 9 months. Since being declared cancer-free, patient has gained 5 pounds back and hopes to gain another 10 to 15 pounds. Patient explains that he doesn't experience regular fever, chills, night sweats, excessive fatigue, or intolerance to heat or cold. Given patient's diagnosis, it is important to assess the head, ears, eyes, nose, throat, and neck. Patient explains that he doesn't experience headaches, dizziness, or vertigo. Patient currently doesn't feel pain, but at the time of his chemotherapy, patient rated the pain in his neck as a 9 out of 10, and describing the process of swallowing as a sharp pain. Patient also experienced pain when he began to start eating solid food, which he rated as a 7 out of 10 as he finished his food. Patient has not experienced any visual changes or injuries of the eye. Patient experienced loss of hearing from his right ear due to the radiation. Doctors explain that it is possible that he may gain his hearing completely, and patient is remaining optimistic. Patient's last eye and dental exams were both within the past year. Patient experienced persistent voice hoarseness following the cancer. At the time of his illness, patient could not talk and attended speech therapy 3 times a week for 3 months. Patient reports no unusual sore throats except in the winter months due to the dryness and temperatures. Patient received radiation to the neck and explains that at the time of his cancer, he felt extreme tenderness in the area. Given patient's diagnosis, it is also important to assess the lungs and thorax. Patient has no history of pneumonia, bronchitis, or asthma. Following chemotherapy and radiation treatments, patient recalled shortness of breath due to the low stamina that lasted the first few weeks. Patient experienced persistent coughing for 3 months due to the cancer and radiation treatment. Cough was productive and consisted of heavy mucus. Patient never experienced pain or wheezing with breath. Hint. Upon examination, patient appears calm with no distress. Skull appears round, symmetric, and appropriate size for the body. Skin is smooth and even color, and all the facial structures appear symmetric. Patient has full range of motion of his neck. Trachea and cervical vertebrae are midline with no notable enlargement of the thyroid during palpation. Patient's cervical lymph nodes are movable with no enlargements. However, tonsillar lymph nodes still feel slightly tender. During inspection of the eyes, patient's eyelids approximate completely when closed. Eyelashes are evenly distributed and curve outward. Conjunctiva is clear and moist, sclera is white, cornea is clear, and the iris is of even color. Patient has 20/20 vision in both eyes during testing of cranial nerve 2. Visual fields and extraocular motor functions appear to be intact. During corneal light reflex, reflection of the light is equal in both eyes. Patient performed cover-on-cover tests without movement of the eyes laterally or upward or downward. Patient's pupils are equaled, round at 4 centimeters, reactive to light and accommodation. Constriction of the pupils was both direct and consensual. During inspection of the ear, no deformities or lesions were noted. Pinna was firm yet flexible. Patient successfully completed whispered tests in the left ear, but had difficulty hearing in the right ear. No swaying was noted during patient's performance of the Romberg test. During inspection of patient's nose, no inflammation or deformities were present. Patient was patent in both nares, and nasal cavities were pink and moist with no redness or irritation. No tenderness or pain during palpation of the frontal and maxillary sinuses. During inspection of the lips, no cracking or lesions were apparent. Patient showed no signs of crepitus during palpation of the temporomandibular joint. Buccal mucosa is pink and moist. Teeth are white and straight. Gums are pink with no inflammation. The soft palate is pink. The hard palate is white. Tonsils are a +1. Tongue is mobile during testing of hypoglossal nerve. During testing of glossopharyngeal nerve, the soft palate rises and the uvula is midline. During testing of vagus nerve, gag reflex is intact. Voice hoarseness has been persistent but improved since patient's original diagnosis. Physical exam of the respiratory system. During inspection of the thorax, patient's chest appeared symmetric, free from injuries or deformities, an even color, and his AP diameter had a ratio of 2:1. When observing his breathing pattern, patient shows no signs of distress and had a normal rate and depth to his breaths. Trachea appeared to be midline during palpation. Expansion was palpated for posteriorly, as well as tactile phlebitis and palpation of the ribs and thorax. All lung fields were auscultated anteriorly, laterally, and posteriorly, with no sounds of wheezes, crackles, or rhonchi. However, if auscultation occurred during the time of the patient's illness and treatment, crackles may have been heard along the bronchioles during coughing episodes or times of shortness of breath. Auscultation for bronchophony, egophony, and whispered pector colloquy showed no signs of consolidation in the lungs. Based on the patient's chemotherapy and radiation treatment, I would perform a neurological assessment as my first pertinent system. According to the 2010 Current Oncology Reports from the U.S. National Library of Medicine, the central nervous system and peripheral nervous system are very susceptible to cancer treatment. The commonest of these complications are radiation-induced injury to the brain, spine, and peripheral nerves, and chemotherapy-induced peripheral neuropathy. The suppressant effect of cancer and its treatment on the body's immune system can result in infectious complications within the nervous system. In order to assess the neurological system, I would present the patient with a mini mental exam in order to assess his mental status. I would also assess his motor and sensory functions, as well as his reflexes, to ensure no neurological damage. Pertinent system number 2, abdominal. Chemotherapy has also been known to cause diarrhea and irregular bowel movements for patients. Because of this, the next pertinent system I would assess is the abdomen. According to the Clinical Journal of Oncology Nursing, chemotherapy causes damage to the intestinal mucosa, resulting in neurosis of the cells that lines the intestines. Those necrotic or dead cells increase inflammation within the intestinal mucosa, causing decreased intestinal absorption and resultant diarrhea. When assessing patient's abdomen, I would first ask about the patient's nutrition, pattern of bowel movement, and note his last bowel movement. If patient reported diarrhea, I would ask about the color and consistency. I would proceed to listen for bowel sounds to be sure that I heard 5 to 30 irregular high-pitched sounds in each quadrant. I would also palpate each quadrant using light and deep palpations to feel for tenderness, masses, or enlargements.